Hi, my name is Ciara. I'm with Welcome Family Senior Solutions, and I have Alex here. He's another placement.
I also do home care. What that means is in-home care, so we're non-medical. So people coming into your home and take care of individuals.
Perfect. And we're just going to collaborate because we actually met at a Parkinson's conference, and we just kind of wanted to go over a couple quick questions that people might have if they're dealing with Parkinson's or caring for somebody with Parkinson's. There's just so many levels to this. He has a personal experience with it. He does a lot of education with it. So we just kind of wanted to share our knowledge.
Parkinson's looks different for each individual.
Yeah, so we got to keep in mind it might not fit your person, but just good information to have for sure. So our first question is, how do you speak to a person with Parkinson's?
In my experience, speaking to somebody with Parkinson's, you need to speak to the person, not at them. So what that means is when you walk into the room, acknowledge them, not just acknowledge the caregiver or the loved one that's in the room.
Yeah, I think that's really important because sometimes care staff comes in and then you forget that, you know, the resident's right there and you've got all these questions, so you're just talking and you just don't really incorporate having them be part of the conversation, because even though they have these new struggles, that doesn't mean they don't understand what's going on.
Make sure they have a voice in the conversation.
For sure. Okay, and then second question, what positive things have come up from having the diagnosis?
Yeah, so personally, my grandmother had been diagnosed with Parkinson's when I was in high school, so a long time ago. But in 2010 and 2012, we did the Muhammad Ali Parkinson's Walk in Tempe Town Lake, here locally. And that brought our family together for a common cause, and a beautiful cause. And that really changed my trajectory on thinking of how beautiful life can be if everybody has a common goal. So that's a very beautiful thing, connecting families together for a common cause.
Number 3, so we've got, what are some benefits to physical activities?
There's been research heavily on physical activity, especially high intensity. So HIIT workouts have slowed down the progression and stopped progression in some patients. So high intensity workouts, so running, hiking, or treadmill. So that has shown a significant decrease in Parkinson's getting out of hand.
I remember when we went to the course, one thing that they had mentioned, because I had the question of like, well, what if they can't run? What if they can't? And they said just to initiate working out, movement, and even if they're not doing it appropriately. So if you're like, move your arms up, and they're just like, you know, you still just want them to have the thought process of the mobility. So they want to just kind of make that connection, even if it's not fully. Because I was like, you know, I have Parkinson's patients that they wouldn't be able to follow that instruction, but they might be able to move a little bit in that direction. And I was like, well, is it more important to actually move, or is it more important? Because then I was like, oh, I can help them lift their arm, you know? And they were like, no, it's not really the movement. It's the thought process that we're actually going for. The thought process of moving their body, coordinating the left and the right side. And so that was a really good tip that I hadn't known, you know?
Yeah, even flexibility. So if you're like somebody that can't move or run, like you were saying, just being able to stretch, keeping that flexibility involved.
Yeah, especially with them getting like contractures and getting really stiff and rigid, you want to make sure that you can move them comfortably, but you can't, you know, push it. You don't want to push it. So with the same question in mind, what are some benefits to working the mind versus physical?
So the mind controls everything, right? The brain. And so if you can keep that connection strong, so crossword puzzles, Yahtzee, any type of game that interacts, especially with loved ones or community members, that's gonna keep that connection strong, kind of like working out. So,
and they've got a lot of apps and things like that for that too, right? So it's not just puzzles and stuff, but there's a lot of mind apps that we can definitely look into.
Yeah, we partnered with Memory Lane Games. So it's an app that is being researched by ASU and Mayo Clinic. Just seeing the connections being made with not just Parkinson's, but with dementia, and seeing the benefits of working out the brain.
Is that easy to, like, have you found it easy to use?
Yeah.
helping others use it?
Yeah, it's really nice because sometimes caregivers, family members and non-family members, don't know what to do with somebody with dementia or Parkinson's, but they want to interact. So these games allow people to interact with their loved ones, and it's not always meant about getting the right answer or the wrong answer. It's meant to stimulate the brain, bring up old memories.
Oh, okay. Oh, you did mention that it had a lot of like older actors and stuff that's more relatable to their age group, right?
Yeah, it even is in different languages. They're even doing local languages here like Navajo.
Oh.
So they're doing a bunch of different
that's really cool.
aspects.
So number 4, is Parkinson's genetic or is it always genetic?
Yes and no. So what that means is you could have the DNA markers, and Muhammad Ali Foundation down in Phoenix here is asking people if they want to get tested, and they're asking people that have family history to get tested. But that doesn't always mean that they're going to have Parkinson's down the road. So it's about 80% of it has to do with environmental.
So you can have the markers, but they're just predispositions.
Mm-hmm.
So if you're keeping a healthy lifestyle, active your mind, active body, that might lower some stuff.
Yeah, so like we were saying, working out, keeping your mind active.
Yeah, because I believe getting tested isn't covered by insurance, but it's expensive, right?
Mm-hmm.
A couple $1,000s.
Yeah.
But it's still, I'm sure, helpful for some people that might have like maybe both parents with Parkinson's or something to just kind of be aware of.
Mm-hmm.
When is it a good time to place or seek help for people with Parkinson's? So I can go over that a little bit. It is really important for anybody who needs care. With Parkinson's, what we think of is, being rigid, shaking. So clearly there's some mobility issues, there's safety issues, there's a lot of anxiety and fear that comes with that. So a lot of care stops happening, even care for themselves, because they're so worried about falls. Like just daily activities that aren't ADLs, but just like calling a friend or going and grabbing groceries, things like that really aren't ADLs. You don't have to do them every single day, but those are starting to lessen. They're not really having as many conversations with people. That's when you'll start noticing like, hey, they're kind of keeping themselves secluded a little bit more. So then they're like, okay, I feel in my safe zone, and then they're in their homes, and then that's when falls happen. They start not eating as many times a day. They're not brushing their teeth, maybe not brushing their hair. Those are the ADLs that we're talking about, which are activities of daily living. Those are the ones that places like assisted living homes, assisted living centers will help with. So all of those things help with just, infection control, staying healthy. So even just having somebody there, motivating them to get up to have lunch, there's that mobility that they know somebody's there and they're not going to fall and they're not going to hurt themselves cooking. So when you start noticing some of those daily activities are starting to decline, that's probably the best time to start looking and start talking to them about like, why don't we find some place that you can find comfortable first before you get to a point where we have no choice and we've got to place you because of safety. So we always try, as placement agents, we're always trying to place people as early as possible, so that way people have choices and they have the ability to actually come out and look at the homes and have that freedom of choice. So it's really important to kind of see some of these signs to make sure that we can get them somewhere safe quickly, and they can actually, as they decline, the staff already knows them, the staff already knows what they're able to do, and they can actually notice when a decline happens, so that way they can start addressing that with more therapy, whatever their specific needs are. But that's how I would.
Yeah, or even when you first get diagnosed, it's always nice to have an early jump start on something. Mm-hmm. So some of these places might not be here, but knowing, hey, there is a placement agent, and what does a placement agent mean? Mm-hmm. Because not a lot of people know what a placement agent does. So knowing that, making connections, asking people around you in the community, I don't think it's ever a wrong time to get started.
Yeah. And even working, like we work together, we work for different companies, but coming in and collaborating. If I have some homes and I can't find something for you, I can always reach out to another placement agent, and he might have some homes that might be closer to you, or got a different environment that you might like. So it is about working together and just making sure that we all have a good foundation of what your needs are, and then we take that information and we find the right home for you.
Exactly. So, and some of these homes might not work out for that individual, so that's a good thing to know. So, give somebody what they need to have. Like, what are a few things outside, beautiful outside,
Yeah.
is important to that individual. So, knowing the places that don't have that is crucial.
Yeah. Ultimately, it's your home, so we want to make sure that your home has either some of the same feels as your own home does, or, you know, just new experiences with the educated staff. And again, just knowing your baseline so they can grow with you and be a positive part of this new foundation you have that we've got to all work toward.
Exactly.
Thank you guys for tuning in. My name is Ciara. You can find us on Instagram, TikTok, Facebook, and YouTube if you look up Welcome Family Senior Solutions. And you can reach out to us for anything, for any questions that you may have with placement, Parkinson's. We can definitely guide you in the right direction.
And I'm Alex with Always Best Care. You can find our company on Facebook and Instagram as well at Always Best Care Tempe.
See ya.
Later, guys.